happens if PEPFAR isn't reauthorized, a webinar co-hosted by the Global Health Council and the Global AIDS Policy Partnership. I am Elisha D'Angiorgio, the President and CEO of Global Health Council, and I'll be your moderator for today's session about what happens if PEPFAR isn't reauthorized. So, there has been extensive discussion around PEPFAR reauthorization in the media, online, and through the rumor mill. It's hard often to know where things truly stand. And technically, authorization for the program ended on September 30th. At the moment, there's no clear outcome or concrete timeline for reauthorization, but we wanted to have this webinar to talk about what that really means from an advocacy standpoint, an implementing standpoint, and a partner country standpoint. So today's panel is really intended to offer all of you a candid assessment of the landscape, including the implications for all stakeholders. And most of all, it's intended to redirect anxiety into action and provide a reality check. PEPFAR is not going anywhere anytime soon. And that's an important message that we are all going to relay over and over again in this webinar. So before I introduce our panelists, just a few logistical notes. We had a really high level of response to this. We had over 700 people register, and I see we're still increasing past the 100+ mark online. So we're running this meeting as a webinar, and that means that audience members are muted. So in order to submit questions, you need to either put them in the Q&A or in the chat. You can find both of those icons at the bottom of your toolbar. And we'll go through our panelists' presentations and conversation, and then we'll try and take as many questions as we can afterwards. If you want to direct your question to a specific panelist, please indicate that as you type in your question. And also, please feel free to introduce yourself in the chat. We'd love to know who's on the call. And lastly, I think as you have seen, we're going to record this webinar so that we can share it with folks who could not be here today, as well as any others who are interested in having that have registered. Okay, so I don't want to take up all the time with logistics. So without further ado, let me introduce our panelists. We're really happy today to have with us Jen Cates, the Senior Vice President and Director of the Global Health and HIV Policy Program at the Kaiser Family Foundation, Katie Koester, Global AIDS Policy Partnership Co-Chair and Associate Director of Public Policy and Advocacy at the Elizabeth Glaser Pediatric AIDS Foundation, otherwise known as EGPAF, to those of us who don't want to say that very long name. Mark Legon, Chief Policy Officer with Friends of the Global Fight, and Richard Mucco, Regional Implementation Advocacy Manager with AVAC. Thank you all for taking time with us today to discuss this very, very important topic. So Jen, I'm going to ask you to start us off and explain some of the legislative background and the processes surrounding PEPFAR's authorization or lack of, and what that means from a policy viewpoint. So let me turn it over to you first.
Great. Hi, everyone, and thank you so much to Elisha and to GHC and the GAP for pulling this together. I think it's a great opportunity, and we don't do it enough to kind of come together and share what the facts are, what's known, as well as the unknown. So hopefully after this webinar, you'll have, for the attendees, we'll have more of that information. So what I'd like to try to do is a bit of a level set on what reauthorization means in the context of U.S. law and what it means in specifically with where we are with PEPFAR. I talked to a lot of media in the U.S. and a lot of organizations in the U.S., and many people in the U.S. are confused about this. So I imagine that outside of the U.S., understanding some of these nuances in the way that our Congress passes laws is confusing. So I'm going to try to, in a simple way, explain it that I think will help people understand what is really happening. So I think the first thing that's important to know is there's basically two main kinds of legislation that our Congress passes. I'm oversimplifying. So for all the technocrats out there who are going to come back and say, but what about this? Just bear with me. One is authorizing legislation. And in our legal system, our law system, or our Congress, that really means legislation that Congress passes to create things, to create programs, to create new policies, to provide oversight. It doesn't provide the money directly. It really is about the structures of programs or departments. So think of it that way. It could direct programs to do certain things, certain requirements, provide oversight, say if you get money, this is how you have to spend it. So think of it as sort of like this is your agenda, and this is what you have to do, or what we want you to do. And that's what authorizing legislation does. In an authorizing bill, there could be very specific things, or it could be very general. And those specific things could say, if you get money, you must spend it like this. Those specific things could say, after a certain date, you no longer exist, or we want you to send us a report every year for the next 3 years. It could provide all kinds of things like that. In the case of PEPFAR, when it was first created in 2003, it was created with an authorizing bill that talked about what PEPFAR should be, how it should be run, where it should be located, what requirements there might be for the program. It's been reauthorized I should know this, 3 times since. Each time it's made some adjustments or continued as it was. But essentially, it has provided the guidance to the US government on how to create a global AIDS program. And this is really important, and I'll reiterate this. If you read through it, there is nothing in there that says PEPFAR ends. In fact, PEPFAR is a permanent part of US law. It was created that way. And I'll get to some specific things that.
No, I think Jen has frozen. Just as she was getting to specific things. Jen, can you still hear us? Okay, well, there you're back. Okay, great. Yes, you were just about to talk about specific things, and then you cut out. So sorry. Back to you.
Can you hear me?
Yes.
So much for being in an office and attached to like a high speed, in the United States. So I was going to say let me know, do this if it happens again. So there could be very specific things in an authorizing bill, or it could be very general. And I think that hopefully you heard me talk about how PEPFAR has a little bit of both. So in the authorization bill and the reauthorization bills, there are specific requirements, but the program itself has no end date. It is permanent part of US law. Importantly, though, if Congress doesn't provide any funding to PEPFAR, to any program, it doesn't matter if it was created as permanent part of US law. It needs to be funded. And so that's where appropriations bills come in. And every year, our Congress has to decide how much money to give to PEPFAR and the Global Fund. And so those are a 2-step process. And one does not necessarily mean the other will or will not happen. So I think that's really important to understand. In general, both are required, but because PEPFAR, as I mentioned, is a permanent part of US law, it continues to exist as long as Congress funds it. And I think for advocates on this call and others and people outside the US, that is a message that I think we want you to understand. Just because it hasn't been reauthorized doesn't mean it ends. There are some specific provisions in the law that actually have end dates attached to them. And those end dates were September 30th, 2023, with one exception for next year. Just so everyone knows, and we have a full list of those, we could talk about those. Those are not things that sort of turn the spigot off or end something. They are requirements for how PEPFAR should spend its money. With those things having lapsed, it means those requirements are not in place. We can talk about this, and Mark probably will talk about some 4 of those requirements relate to the Global Fund. And in some cases, those requirements are quite important for the landscape that we operate in. But the point is, they are not about funding going away or the program shutting its doors. They are about how the money gets spent. And stepping back, it's really Congress's way The authorizing legislation is Congress's way to say, this is what we want you to do. And if those end, Congress has less power over determining what the program decides to do. So, the bottom line message that I think is important is PEPFAR is a permanent part of US law. As long as it continues to be funded by Congress, it continues. There are some specific provisions that have ended, and we can talk more about what that means. It mainly means that there's less of the Office of the Global AIDS Coordinator has more freedom to decide what to do with the money without those requirements being in place. Having said that, and I think this is where other presenters will speak, there are some implications of it not being reauthorized, and I don't think we should, minimize their importance. One is the symbolic implication. If it doesn't get reauthorized in the next, it hasn't now, but if it doesn't, because ongoing discussions are happening, it's a symbolic shift, and it would mark an end to what we have always seen as a bipartisan consensus. And that alone could mean some changes down the road. There's also perception on the ground. Even if, as I could say 1,000 times, PEPFAR continues, if funding is provided, not everyone will have that assurance. And it could create some anxiety, and even more, some programs may or implementers may be reticent to take certain steps. And then I think the open-ended question that I would pose does it make funding more vulnerable if there's not this strong bipartisan consensus? I don't think we know, but I do think so far we don't have an indication that that would be the case. One last thing I'll comment on, because this was asked of me. There's a larger, this is all about PEPFAR, but there's a larger budget battle going on and larger governing battle going on in our US Congress right now. And those, of course, are not about PEPFAR, but they could affect PEPFAR. So currently, our Congress has not been able to agree on a budget for the next year, for the current fiscal year we're in, and was able to have a short-term stopgap measure to continue funding while it tries to figure this out. That agreement ends on November 17th, very soon, and Congress has to do that again. Unlikely they're going to agree on a budget, so they have to do some other kind of stopgap soon. And some have asked, what happens if they don't? And that's what, if they don't, that's when, and this has happened many times in the US, we have what's called a shutdown. Government programs can't operate if they don't have money. So that's not a good situation on many levels. It affects everybody, but everyone should know, especially implementers in country, that PEPFAR, the way that it is funded and the way that most foreign assistance programs are funded, means that they have multi-year money. And the money that is there is actually, there's a cushion to some extent to allow the program to function and not cut off services for people on the ground. So a short-term lapse, which we may experience, should not affect any programs. It might have some effects back in DC, but it should not have effects in the field. So I just thought it would be important to say that. There's a lot more I could say. We could provide links and a list of all of the provisions that ended on September 30th if people are interested. I'm going to stop because I think, what's really important is to hear some of the other perspectives on what this means and what's happening to try to address some of these issues. Thanks.
Thanks, Jen. That was great. That was really helpful. And I think leads us into our next panelist presentation, Katie Koester, co-chair of the GAP, to talk a little bit more about what all of the things you just laid out mean for the advocacy landscape over the coming year and years. So Katie, I'm going to turn it over to you.
Thanks, Elisha. I want to just start and say reauthorization is not necessarily dead. It hasn't happened and it lapsed, but there's still a path forward potentially for a reauthorization this year. And what's really important to remember is that strong bipartisan support for the program remains. We've seen it publicly with Senators Graham and Bozeman leading an op-ed. We've seen former senators, former President Bush, other bipartisan champions talking publicly about support for PEPFAR. And I think it's also from an advocacy community perspective important to remember that we're still really united around our ask around a clean 5-year reauthorization. And I've been working in this community for a long time, and this has been, I think, the biggest challenge we've had to face. And I'm shocked and really happy to see that even over the last 10 or so months that this conversation has happened, the community has remained united, the full spectrum saying we want a clean 5-year reauth. And so we're continuing that messaging forward and still looking for and working with our congressional champions on a path, but it might not happen. So we have to think about what is going to happen next. We're in uncharted waters. You know, I think in some ways taken for granted that we've had this strong bipartisan support for the PEPFAR program over the past 20 years. When we came into this reauthorization year, we knew that there was potential for policy debates around the program, but we expected that to sort of happen within the family, within the supporters, people who care about the PEPFAR program. We didn't expect to have these attacks from a really vocal minority, very small minority, who don't work in this space and who don't have experience with the program, sort of launching these unfounded attacks. And it caught us a little bit off guard, frankly, the idea that that folks who really haven't talked about PEPFAR before have been attacking the program. But it's a reminder that we have to double down on our advocacy and think about what this means looking forward. I think, as Jen said, this is a symbolic shift. And what does this mean for our funding advocacy moving forward? Are there going to be attacks on PEPFAR and policy attacks on PEPFAR through the annual appropriations process that we're going to have to stave off? Are some of our champions going to cool because there's now this more negative press against PEPFAR and maybe they get nervous about speaking out? So we're going to have to spend a lot of time. I know there's a lot of folks on the advocacy community on this call, and I'm saying this to you, shoring up our champions and building new champions. There's lots of members of Congress right now, lots of senators who've never voted on PEPFAR or certainly weren't around 20 years ago when it was formed. And there's a huge learning curve. It was heartening to see that there was a large number of members of Congress and congressional staff that visited PEPFAR countries over the summer during the August recess, and almost all came back. Everybody came back. It's incredibly impressed by how well the program works and wanted to do something to help the program. So I think that education piece is going to be really, really really important for us as we move forward. But and the last thing I'll say on the advocacy piece is, I think this does put all global health programs at risk through the annual appropriations process. I know there's friends of ours on this call who are in the family planning community who know what annual attacks and staving off policy attacks are like. And I think bleeding into PEPFAR could potentially bleed into the broader global health funding battle around maternal child health, tuberculosis, malaria, the big operational programs in country, and we don't know what that means. And so I think this is a time where in the past during appropriations, really what we're pushing for is more money, always. Haven't always been that successful, but we certainly haven't seen cuts. But I think now we're going to have to be even more strategic around the policy side of the program. And the last thing that I'll say looking forward is, because we're entering these uncharted waters and we don't know what this means for the planning of the program, for supply chain management, for manufacturing, the confidence of the people in our country. And I'm looking forward to hearing from Richard's perspectives, because this is the first time we won't have this 5-year authorization. And as Jen said, it's a permanent program. It exists. It's always been contingent on the amount of money the program has. But does this symbolic shift, is that going to sort of cause a domino effect more broadly on the global stage? And that's what we'll be looking for over the next few months. So I'll end there.
Thanks, Katie. I know it's a big lift in front of all the advocates in the U.S. and throughout the world. So turning to the global stage, I'm going to ask Mark from Friends of the Fight to come on now and talk about the relationship between PEPFAR and Global Fund, and really what this means moving forward. Mark, over to you.
Delighted to be here on an important topic. You know, I got to start with, you know, our solidarity with all of you globally who work on trying to advance the goal of preventing, treating, and reducing the horror of HIV/AIDS. So why is PEPFAR so important to the Global Fund? Well, I mean, it's really a spine within the Global Fund's work. An immense number of the 59 million people who've been saved over the last 2 decades by the Global Fund working with partners is because of PEPFAR. PEPFAR and the Global Fund coordinate very closely, but I will say that the authorization of the program is at first step important to the Global Fund because the Global AIDS Coordinator is the US representative on the Global Fund board. It's a major voice in the work of the Global Fund. The way the Global Fund operates is it has a multi-stakeholder governance, and it's important. A lot of approvals, a lot of direction happens at the board, and it is there that the United States weighs in. I've witnessed it in many of the board meetings, and I'm aware of it, playing out in terms of relationships between PEPFAR and the head of the Global Fund, and then, on all sorts of votes. But more importantly is the coordination. The Global Fund takes part in the COPs, but PEPFAR in many, many countries plays a role in the so-called country coordinating mechanisms. Some of you may, know very well, but the Global Fund insists on a multi-stakeholder group that it interacts with in countries. So it's not only talking to national governments, but local implementers, civil society, faith groups, and others. And PEPFAR is always in the mix, and that adds to the value of the proposals sent in for possibly being funded by the Global Fund, technically and with a human rights lens. The Global Fund and PEPFAR coordinate, and they think about their complementarity. So to date, the Global Fund has been all the more focused on commodities in the division of labor. It's played a huge role by its large buys and pooled procurement, driving down prices for low and middle income countries. And it has a comparative advantage in that way. I think there's dialogue now between PEPFAR and the Global Fund, whether some things evolve, but it's a self-conscious plan for who does what. And in the situation of stockouts, they have functionally backed each other up so that people in need don't go without their treatment or don't go without their access to prevention, PrEP, and so on. And PEPFAR is very well known, especially among those who are not as steeped in it as you are on this webinar. It's known for the DREAMS program, among other things. And where the Global Fund does work on gender, it's self-conscious about talking to PEPFAR about not doubling up in places where DREAMS is operating, but to fill other spaces, different regions, different places in countries with its own work on gender equality as a key part of not just advocacy work, but operational work. Both faced COVID-19 at the same time, and they conferred throughout. So as the platforms of PEPFAR and the Global Fund were leveraged to further strengthen and build the resilience of health systems, to directly help countries on and healthcare workers, community healthcare workers have PPE and so on. They coordinated. They both, we've been talking about how each contribute to pandemic preparedness and larger health goals. But their cooperative relationship was kind of, particularly clearly seen in the COVID era. A lack of a multi-year reauthorization is not devastating in terms of funding for PEPFAR and the Global Fund being turned off, as Jen aptly describes. But it makes it far harder to do the kind of planning to extend the amount of human rights based work to stretch every dollar of the American taxpayer farther and to do more good. So it really undercuts that ability to cooperate. Uncertainty is there, as well described by Jen and Katie. I want to say a word about the private sector, because the private sector, while controversial with pharma at times, is a very important part of the partnership work of PEPFAR and of the Global Fund. Both have it in their DNA, both have sought partnerships. The Global Fund's added value, among other things, is to try and speed innovations to deployment. But the fact that the Global Fund provides for pooled procurement, which propels prices for commodities down in low and middle income countries, that kind of pooled procurement, purchasing agreements, those are harder to do, harder for private sector entities to predict. We at Friends of the Global Fight have been emphasizing the need to focus more on the demand and needs of human beings in communities over supply and all this discussion of supply chains. Well, the ability to do both is harder, and that so getting the best out of the private sector with open eyes about its own way of operating is harder without a multi-year reauthorization. There's also just the symbolism, the bipartisan nature of support for the Global Fund. I will note that the House Republican majority passed a state and foreign operations appropriations bill for fiscal year 2023. And it cut the overall foreign aid of the United States by 12%. It cut global health funding by 5%. But there's a robust support for the Global Fund. And the House Republicans moved a bill through Congress, through the House, that sustains $2 billion for the Global Fund. And that was carrying forward a 28% increase earlier. Now, we're very sensitive to our colleagues in the health community that everything in health be funded more fully. But it is a sign of the bipartisanship on the Global Fund. A lack of a 5-year reauthorization really is not only a sign of breaking down consensus, but it could become a driver of breaking down consensus. We're concerned about that for PEPFAR's own sake, but also for the Global Fund. So the main thing I was asked by my colleagues here to talk about is the one of the requirements Jen alludes to in the PEPFAR reauthorization related to the Global Fund that's probably most well known. It's the cap placed on how much the United States can contribute to the Global Fund. It is carried in the PEPFAR reauthorization legislation. And it is a provision that says the United States cannot pay more than 33% of the Global Fund's budget. That's quite generous. Compares very well with our dues to UN agencies and so on. But it propels burden sharing. There's been a very clear record of other countries stepping up with us because they know they'll be leaving US money on the table if they don't step up. And so, we saw Germany, European Commission, Canada, Japan all increase the same hefty amount of 28% that President Biden proposed because of that. So that provision in the PEPFAR reauthorization bills has actually kind of become a norm, that the expectation is that the United States not only can contribute up to 33%, but it will contribute 33%, because in the opposite direction, it leverages $2 from other donors for every dollar it gives. So the 5-year reauthorization is a long-term device. This is why 5 years rather than 1 or 2 years really matters for the Global Fund. That device to affect other donors and for them to have the feeling that they will not be able to unlock the US money over 3-year replenishment periods that device becomes markedly weakened if it's only 1 year. So I've reemphasized that funding for the Global Fund and PEPFAR can continue without a reauthorization, but there are a lot of downsides to not having a multi-year reauthorization that's clean, that doesn't make any changes and breaks open earlier compromises. We might get the 33% cap as a good thing. We might get it included in each annual state and foreign operations appropriations bill. For instance, supporter Lindsey Graham, a Republican senator who's the lead Republican on the foreign aid related subcommittee, he would intend to just include the 33%. But there's no reason to think it's necessarily the case that it would be included by the House Republicans or in general. There's good reason to think it might be included, but without the multi-year reauthorization, it isn't certain. My last thought is that, having talked a bit about the private sector, I'm really eager to hear from Richard about civil society, since civil society is a crucial part of the DNA and the multi-stakeholder model of both PEPFAR and the Global Fund. I look forward to your questions.
Thanks, Mark. Thank you so much. So we've spent quite a bit of time so far talking about the global level policy, US policy, which is, of course, important for making both these programs happen. I think, though, we all can agree that the real power of PEPFAR and of Global Fund comes at the country level, and the difference that they have both made in so many lives. So I'm sure all this uncertainty is of concern, and I think we've heard from all the panelists there's a lot of unanswered questions still about the future of PEPFAR. So I'd love now to turn to Richard and hear from you how this is impacting, how all this uncertainty is impacting partners outside of the US, and where you feel there's a need to improve advocacy support at the country level for PEPFAR. So Richard, over to you.
Thank you so much, and thanks for this particular invitation. First, maybe I will start by saying that there's nothing more life-affirming like a program that allows children to be born HIV-free, and for those born with HIV to grow to adulthood and have children of their own who are HIV-free. So PEPFAR is a generational life-saving program that is life-affirming like no any other, there have been, while really discussing about exactly what the people feel around here, I basically thought in terms of really addressing some of the issues that have come while this particular reauthorization debate has been going on. One has been the accusations that, of course, PEPFAR is basically a particular model of colonization, that it is basically imposing Western values on recipient countries. However, this has not been true. As you can see, there has been this particular tripartite model where we have CSOs on one hand, we have the countries on the other, and we have also PEPFAR on the other, basically discussing this. And this means that, of course, the PEPFAR team have always basically come together with country teams to develop priorities together. And of course, we know that nothing happens in PEPFAR headquarters before the consent of the recipient countries. And so we move also to the outcomes nature of PEPFAR and the peer-to-peer consultative process between the US and, of course, the recipient countries. Of course, how do we see this? We see this as a unique and groundbreaking model in international foreign aid. Which means that this particular model is creating a platform for other forms of international aid programs to learn from. its unique decolonization aspect. It's quite rare to have exactly donors discuss, in most of the cases, it's basically a donor giving the grant, and of course, in any case, just providing directives. But of course, in here, we see exactly there's that particular collegiality and that particular sense of brotherhood and sisterhood. So PEPFAR as an international program has been very, very successful in breaking power dynamics between we as recipient countries and of course, and PEPFAR. So you see exactly the two of them sitting together, discussing together on how the program should look like in the recipient country. In essence, from this model, we see that it's peer-driven. And of course, these are peers who are collaborating to a shared end and not a powerful donor on one hand dictating to a helpless recipient on the other. So there are many beautiful PEPFAR outcomes. And when we discuss about the reauthorization, and of course when we have had several meetings also with CSOs on the ground, people, of course, one of them is basically without the powerful procurement, with the procurement power of PEPFAR, treatment and prevention would never have reached the scale and magnitude it has reached today in African countries. And then in a big way, PEPFAR has contributed to not only strengthening human resource cadre for health in our countries, but it has really contributed to reducing the HRH gap. Of course, we have PEPFAR and Global Fund, who have done this particular great work and which basically remain big. So, and over the years, it has continued also, before there was basically the ABC, but over the years, there is the ABC Plus, which basically included the structural barriers. And of course, targeting the most HIV impacted people through programs such as DREAMS. For HYW, we can be able to see also some microfinance, education, and of course, also for the OVCs and things like that. These were basically the people. I mean, these were some of those particular small bits and pieces that were aside from treatment that were able really to keep many, many vulnerable people, including orphans and vulnerable children, out of HIV. And of course, we also saw the KPIF for key populations and DREAMS for HYW, that is adolescent girls and young women. So you can be able to see PEPFAR has really been quite innovative, and it has contributed to really big ways in strengthening countries' supply chain systems. And it has also ensured treatment and prevention reach all who need it. You see, and then, of course, we look at the reauthorization, from the South as a matter of life and death. So what we basically ask is, US should not for any reason pull back from this life-affirming program. It will be quite unfortunate. By continuing the assistance, it does not mean that US is creating dependence, but it is also helping us to create strong and resilience programs. A lot of progress has been achieved in the recipient countries since the start of this program. It's sad today that the reason for wanting to back off is based on misinformation and outright lies. We try to imagine, of course, most of my African peers here and partners would basically attest to the fact that we have not had any abortion funded by PEPFAR. That's basically, it's really outrageous, because in any case, this is basically a lies. We can affirm that there's no evidence that PEPFAR funds have been used to finance abortion in any of the African countries. It's our prayer that this particular misinformation is corrected, and that, of course, the congressmen and, of course, the Senate in the US is able to take really a good decision on this, not based on misinformation. And of course, we understand that in the medium term, nothing will change. Things will remain the same. But in the long term, the non-reauthorization of PEPFAR will basically have some effects, some negative effects. And of course, these particular negative effects will have some deleterious effects on the HIV response gains so far that have been achieved. You know, this particular life affirming program has given many people lives. We hence really need the US Senate and the Congress to approve the 5 years PEPFAR reauthorization law. Having said that, I think those in Africa, and of course also our program, our colleagues in the US may need to come out of this particular webinar with some concrete set of actions. As now we basically understand that, of course, we understand the nature of this particular misinformation. Let us think what we can do in our countries to make the case for PEPFAR reauthorization and take it forward. We may need to mobilize CSOs in our countries to really make a case and tell the story of the transformative power of PEPFAR. We need to share this message with decision makers diplomatically and in a timely manner. Though the reality in the long run is daunting, panicking will not help. Of course, instead, we may need to take some positive steps and invest our energies and capabilities to work for the reauthorization of PEPFAR. So recipient countries, HIV stakeholders, and CSOs may need to do letters that can be compiled and sent to the US congressional and Senate leaders. Of course, rather than having a single letter, it would be important if the letters came from individual countries such as Kenya, Lesotho, Nigeria, Tanzania, South Sudan, etc. It would be important that the letters get as many sign-ons as possible and be widely inclusive. More so, I think, of course, I still reiterate that, of course, there's PEPFAR and Global Fund, you know, have been really great life affirming programs. And of course, what happens is that we from the recipient countries are always and will always be grateful for these particular programs. Thank you.
Thank you so much, Richard. I think that do not panic is the right way to proceed. So we have quite a few questions coming in, and I'm going to try to bundle them a little bit because I see some similar ones in here. There are quite a few questions about the US political environment and the polarization in the US Congress, particularly around abortion issues, SRHR issues more broadly, and LGBT rights issues and gender. And so I just want to ask, maybe I'll start with Katie on this one. And if you could talk a little bit about, one, whether there's any appetite for compromise among the advocacy community with the more conservative congressional approach, and or, you know, what you see long term as how this polarized support for PEPFAR proceeds. Over to you.
Thanks, Elisha. On the idea of compromise, I believe that from the liberal to the conservative bent of our community, which we are a very big umbrella, which has been fun to see everyone come together and have sort of the same point of view, is they view the current legislation as the compromise. And that I think any of the proposals that we've seen, sort of making the global gag rule or Mexico City policy permanent, is a non-starter. It would certainly be a non-starter with Senate Democrats as well as the White House. And the Helms Amendment applies to all foreign aid. You cannot do abortion with US funding. I know this as an implementer, as EGPAF as a PEPFAR implementer. We follow all US laws as well as the laws in the countries where we work. We're a guest in the countries where we work. And so you can do additional compliance, you know, in that space. Certainly, you can do that without legislation. There is an immense, we have a VP of awards and compliance at EGPAF. He would tell us that we do an immense amount of compliance as it is on these programs. So there hasn't been even a proposal or an idea that is would pass sort of that test. And I think where PEPFAR is and what's really important about the PEPFAR program is that it has the flexibility to evolve as the HIV epidemic has evolved. And that's one of the reasons the current legislation is framed the way that it is. There are obviously restrictions on how much money needs to be spent on care and treatment for orphans and vulnerable children, but within that space, the epidemic is not the same today as it was 20 years ago. And so if Congress wants this program to continue to evolve as the epidemic evolves, it continues to be incredibly successful with essentially flat funding over the last more than 10 years, it needs that flexibility. And so I think there hasn't been anything proposed that is even sort of in the realm of what could be a compromise. And I think our conservative and liberal members of the community would say this is the compromise. And so I do think there is concern, though, about what this means for the program moving forward. Obviously, services for key and vulnerable populations is a huge and important part of the program. It's what's driving the epidemic. We know that as kids, we're looking at, I think, epidemic control in 14 countries. None of those are reaching epidemic control for children. And I can speak to that because it's our organization's expertise. But if you look at some of the other key and vulnerable populations, it's very similar. We have to be doing targeted outreach, and we shouldn't be limited on what that outreach is. We're never going to be able to reach everyone who needs services if people in the United States are saying, well, I don't like this person, so you can't use PEPFAR money to reach them. So I think there is that concern that this intense pressure will somehow cause a chilling effect in country where, especially, government to government money or local implementing partners who get nervous about US politics or like, well, maybe we should pull back in this area because it seems like there's all this press in the United States and maybe that will make Congress happy. So there is concerns about the chilling effect, but I think it's why our advocacy community is so important. It's why civil society involvement in the PEPFAR program is so important to ensure that we're not seeing that pullback in countries and that those populations are continued to be reached.
Thank you, Katie. I'm going to ask Jen to come in here on this because there were also quite a few questions about what is Plan B in terms of funding if reauthorization doesn't happen, but then appropriations also doesn't happen in a way that we need it to. And I think some of that is also tied to questions that have come in around the spillover effect. And I mean, Mark, you alluded to this, as did Richard, about how important the symbol of PEPFAR is and how much it galvanizes support around HIV/AIDS and collaboration with other donors at the country level and globally. And so, Jen, you've studied this for a long time. I know the history of, donor funding and collaboration around HIV/AIDS. So maybe you could come in a little. I don't think there is a Plan B, but if you have a Plan B, we would love to know it.
Yeah, I think we're in uncharted territory with PEPFAR right now, and I think we just have to acknowledge that. It's not that PEPFAR itself has never been subject to some of these concerns or questions, but up until now, there has always been a path forward with, as Katie said, this is the compromise. There are things in the current authorization that both sides are not happy with, and yet the bigger picture has always been recognized that this is a life-saving program that has, changed the course of what would have been a more devastating disease and pandemic than it already was, and that has really driven the support. We're not at that point right now exactly, and I think that's why we're all saying symbolically, we have to acknowledge it's important to that we don't know what could happen. I think, though, there were some questions in the chat about, could PEPFAR get funding from other places? No, this is PEPFAR gets funding from the U.S. Congress, and in fact, I think Elisha, maybe this is what you're getting at. It is the funding part is probably one of the most important here, because if we look at other donor governments, which is something else we look at, they are not stepping up on HIV in the same way that they used to. Really, it's the US government, and the next largest donor is way behind. And even if you standardize it to, the US has a huge economy, it's still paying more than it's, it's punching even above its weight, even though it has a big weight. So I don't think there's a rescue plan out there. So I really think it's about what happens with the US, and that's true of most foreign aid programs. If the US shifts in any way, it has a big impact on the ground. So so I think it is important to recognize the vulnerability. Mark said something that I meant to mention, which is, despite all of this, and despite the fact that our Congress has not been able to agree on a budget, there were some individual appropriation bills that did get passed and move forward in the midst of all this inaction. And one of those was the bills that fund PEPFAR and the Global Fund on both the Senate and the House side. And those actually provided a lot of money to those programs, essentially level funding. The House bill did have the expanded Mexico City policy provision in it for all of global health. And that's, as Katie mentioned, a non-starter on the Senate side. But the funding wasn't questioned at that point. So that's an indication that it hasn't yet necessarily affected those top line numbers. So that's one. Two, someone asked in the chat about the shutdown, and I think they came on after I mentioned this. If there is a shutdown, meaning if our Congress can't agree on another stopgap, another continuing resolution after November 17th, the government shuts down in many cases. PEPFAR is fortunately has a pipeline of funding that will mean that ARVs are still going to people. They're not stopping. There's money in there. So a short-term shutdown should not affect services that people receive. There'll be some disruption more on the administrative side, but it will not affect services. Something more longer term, yes, but then we're talking about that, then the whole country's in peril. So, keeping in perspective, I think PEPFAR is an okay place. Somebody also asked about a Washington Post article that just dropped while we were on this webinar, and that raises another issue that I think we all just should be cognizant of. So far, we've talked about reauthorization, which again defines or creates programs. We've talked about appropriations, which gives money. And then there's another thing that happens. Congress has already given money to PEPFAR every year. And after that money is already provided, the program still has to get some congressional approval to spend the money in specific countries. That's not a PEPFAR thing. That's how a lot of foreign aid works. So this year, in this fall, when that process happened and the Office of the Global AIDS Coordinator sent those notifications up to the Hill, the same offices that are raising these questions about PEPFAR are raising questions about the language in some of those country plans. And the Washington Post article basically says that they are holding up the money that's supposed to go out as part of this year's COP. I would posit that that is a more serious challenge right now than the fact that we've passed September 30th without a reauthorization, and the fact that we don't have a budget yet, but we have a continuing resolution, because that affects existing funding that's already been appropriated, funding that is being spent in ways that has been spent in the past, including in the prior administration. So that's what that's about. I guess all of us could talk more about it, but it is something that is happening right now. Thanks.
Thanks, Jen. While you're here, there was also a question, it was for Katie, but I think you could answer it as well, about what this means on the 10% set aside for orphans and vulnerable children. And then I'm going to turn to Richard with a question about the disinformation issue that he raised. But if you can answer that one quickly.
Yes. So as I said earlier, the fact that the program hasn't been reauthorized, wasn't reauthorized on September 30th, means that anything in the language that has an end date is no longer required. And one of those, it was a requirement that at least 10% of bilateral funding, the funding that goes to the US to spend on HIV, not the funding to the Global Fund, has to be spent on orphans and vulnerable children. So a minimum requirement to spend a certain amount of money every year on that population, on that set of services. That requirement is no longer in place right now for future funding. What does that mean? That means PEPFAR, the US government, could decide to spend less than 10% on that population and those services. PEPFAR could decide to spend 10%. PEPFAR could decide to spend 15%, but it is no longer required in the law to have that minimum amount. And so that some people say, well, the program is still serving that population. It's okay. Others say, we don't feel comfortable. That's so important. We want a requirement. If that becomes an important issue, Congress certainly could add language to an appropriations bill requiring the money to be spent that same way on an annual basis. So that's true of all of the requirements that have ended. So nothing, the doors don't close. It's just the way that the program has to spend money or report on it. Those requirements are no longer in place.
Thank you. Thanks, Jen. Yeah, and I know we have some good resources that Kaiser has done and others on what requirements are still in place and what are not, as well as some other good pieces that we can send around after this webinar along with the recording. So we'll share our links. I see some people have been sharing links in the chat and the Q&A. We'll make sure that those get to everyone. Richard, I just wanted to come back to you because we had a few questions in the chat or comments about conquering some of the misinformation that you so, robustly mentioned as a problem, which we all recognize it is both in the US, but in other countries as well. And I'm wondering if you could talk a little bit more about, advice on how public health professionals can counteract that. And, you mentioned panic before. I think Emily Bass asked, can we use a different word than panic? Since there are real concerns and strong concerns that everyone has that are justified. So I'd just like to ask if you could speak a little more to the way forward that you see on those two things. Oh, you're still on mute, Richard. Still muted. Oh, you're showing Emily's book.
Yes. Oh, hi, Emily. I've got your book here. It's really a great masterpiece on PEPFAR and the amazing work PEPFAR has done. I would basically recommend this for anyone, who wants to understand that. So really about, of course, we from the recipient countries, especially from Africa, we have vivid memories of the late 1990s and of course, and the 2000s, several villages, you would basically have about 5 to 6 funerals, people being buried every day. And of course, I think we have come out of that. Now it's like, of course, villages are, people are basically dying of natural causes. And of course, it's like you wouldn't want to imagine that, of course, young people of 30 years, 20 years, we were basically losing them every day. And so what happens is that when we hear about, of course, challenges in PEPFAR reauthorization, immediately images of that nature come to our heads. But of course, on the other hand, we have seen how our health programs have become vibrant. And of course, quite a lot of capacities that have basically been built, in these particular health programs and things like that. And of course, anyhow, as we are basically discussing this, you could be able to see, like we are talking about, of course, human resources for health. PEPFAR has done quite a lot in building these particular capacities. Of course, maybe one of the worry would be like, of course, maybe we are putting some money in a basket that has a hole at the end. It's not that. Of course, the beautiful impacts we are seeing is really, really, really important. And of course, what happens is that we have had, like the plus, that particular plus, where we are talking about addressing the structural barriers and things like that. Of course, people at the margins, at the periphery, have been reached, and PEPFAR has done quite a lot. So, yes, when we basically talk about, panic. We are basically talking about 4.8 million people living with HIV, just, in this particular part of the region. And, and of course, we are basically talking about countries with GDPs that are so small, like, of course, when you talk about addressing the HIV pandemic, it basically means that, of course, quite a great portion of the country's GDPs would basically go there. And of course, countries have quite a lot of other other competing endeavors. So you expect that, of course, this will maybe cause some concern and things like that. However, there are those particular, and of course, countries at the moment are also working on their sustainability plans. And PEPFAR has been really instrumental in helping countries to work on towards this particular, to work towards basically a sustainable model of really taking the HIV forwards. And of course, within this particular sustainability, of course, the CSOs are in there trying to ensure that the most impacted groups are not left behind, and things like that. And of course, we need exactly the accompaniment of PEPFAR, especially in this particular process. Thank you.
Thank you, Richard. I think, unfortunately, we are at a little over the hour, and so we're going to have to conclude. I know we didn't get to all the questions. I am just going to ask our panelists if they have any last words that they want to say or share or advice to give before we sign off. So I'm just going to go, really, 30 seconds is what you have. So Mark, you first.
Just a general word, which is that a lack of a 5-year reauthorization isn't the apocalypse. PEPFAR can continue to work. A 1 or 2 year reauthorization is better than none, but there are so many things about a 5-year reauthorization maintaining the existing compromises that will advance the work about HIV/AIDS, and the Global Fund is immensely amplified by PEPFAR's existence.
Thank you. Katie?
Yeah, I think PEPFAR is going to continue, but we're going to need strong advocacy moving forward, and everyone to stay on the same page and sing from the same songbook about PEPFAR's importance and keeping the program strong. And if you want to amp up advocacy, you can reach out to me directly. I'll put my email in the chat. Always happy to have more folks at the table with us. Great. And Richard, any last sentence?
Yes. First of all, thank you, Joanne from Tanzania. I've seen your text there. Yes, we, despite the fact that, of course, there's no need to panic and things like that, but we still need a reauthorization. I think it's really important. Of course, I know our colleagues in the US are working much more harder, especially on that. And of course, we basically have some resources in the short term, but of course, we are also looking at the long term. So at short time, maybe let's basically put all the efforts in trying to influence this particular decision to reauthorize. Thank you.
Thanks, Richard. And Jen, you started us off on the panel, so I'm going to give you the last word.
Last word is, well, first of all, thank you for pulling this together. I think it's been, it's been helpful to me to hear the different perspectives as well. As the facts are, PEPFAR hasn't ended, but, and I'm seeing this in the chat, we have to recognize this is a moment. This moment could have come even without the reauthorization battle. And I think there were signs of this already. One of the things myself and my colleagues have written about related to this is how important it is for US leaders and other stakeholders to communicate to the field right now about what this does and doesn't mean. And that communication is so critical. So regardless of, what is happening in Washington at this moment, I think that need to communicate and explain what is happening is so paramount right now. But thanks everyone, and happy to do this again if there's a need or interest.
Thank you, Jen. Thanks so much to all of our panelists. And I'm really happy that we could, with GAP, pull this together and dispel some of the questions and disinformation that's been floating around. We will send out, following this, the recording, as well as some links to resources. And I know there's some questions that we did not get to in the Q&A, and we will try our best to answer those in the email that comes around with all of the other resources. So thank you again so much for all the good questions, and to our panelists for taking the time, and for everyone's advocacy to keep this program as impactful and as well funded as we all know it needs to be. That's it. Have a wonderful day, everyone. Thanks so much. Take care.